I see we've just been joined by Councilmember Gabe Albornoz. Welcome. So glad you could join us this evening.
Honored to be here. Good to see everyone.
And we will be getting started in, let's see, my clock says 4:57, so about 3 minutes. But we're just waiting for folks to continue signing into the webinar. Great participation this evening. We're up to almost 120 participants, so that's fantastic. Definitely demonstrates the interest in the topic and the desire for engagement and information around this. So thank you again to everyone for joining. So as I see folks continuing to dial in, I'm seeing some questions pop up in the chat. Is this the town hall meeting? Yes, this is the town hall meeting. One of the things about joining events by Zoom is you might not always be sure you got to the right place. I suppose sometimes that happens too with in-person events, but it's usually a little bit easier to figure that out by talking to the crowd. So welcome everyone this evening. Thank you so much for joining us. I see we have just gone to 5 o'clock, so we will begin the official start of this program. My name is Hilary Tsumba. I am the Director of Organizational Strategy at the Primary Care Coalition, and I will be the moderator for this evening's event. Primary Care Coalition has had the honor and really the privilege over the last several months to be collaborating with a number of amazing service provider organizations that are supporting people with intellectual and developmental disabilities, and have done so for many years, and that is core to the mission of the organizations that we've been partnering with. Certainly the COVID-19 pandemic has presented a number of challenges to individuals and organizations across the board. And this group is faced with some very specific challenges that PCC has been really proud to have the opportunity to build new partnerships and find ways to provide assistance in terms of infection control and guidance related to the clinical response to outbreak in settings that are really designed as a social services setting. As we continue with this work, we know that as the vaccine is rolling out, providing education and information about the vaccine is vital, and that is part of the purpose of this evening's event. We have a great program lined up, starting with opening remarks from Councilmember Albornoz, and then will be followed by Dr. Travis Gales. And then the structure of the program will be 2 panel discussions. In terms of question and answer for our speakers, please, if you have questions, put them into the Q&A box that is in the Zoom. Our program staff will be watching that Q&A box and will be condensing questions that have similar themes to send them into me as the moderator, and I'll then pose those out to the panel and to our guests. So with that little bit of housekeeping out of the way, I'm really delighted to welcome Councilmember Gabe Albornoz, who will be providing our opening remarks. Councilmember Albornoz was recently elected to be vice chair of the county council and has also served as the chair of the Health and Human Services Committee on the county council. I've been privileged to work with him in a number of different ways over the last few years, and have always been impressed and delighted that we have such a tremendous leader in the council with true dedication and passion for the community as a whole, and certainly with a real emphasis on following the needs of community members who may experience vulnerability for different reasons. Councilmember Albornoz is a lifelong resident of Montgomery County, and that really shows in his leadership and deep understanding of the county. And so it is my pleasure to turn it over to you for some opening remarks.
Well, thank you, Hillary, and thank you to PCC and all of the elite panelists that are here to answer questions. I will be brief because I know we want to get to the Q&A, but I just want to say a couple of comments up front. Earlier this year, last year actually, the council had the opportunity, each of us, to honor a hometown hero early on in the pandemic, people who had stepped forward to go above and beyond to help their community. And I chose Dr. Mike Greenberg as my hometown hero because at the time, during the early stages of the pandemic, and unfortunately has continued, there was a great sense of confusion, frustration, disorientation to what was going on. And Mike took it upon himself to serve as a tremendous guide to a number of families, primary care providers, and even at one point took the time to make masks out of his garage that he was distributing to as many providers as possible. And so, Mike, thank you for your continued leadership. And Mike would be the first to tell you, he's one of many people that have stepped forward during the pandemic and during this crisis. And I want to begin by acknowledging the incredible work of our provider community who have just been heroic in their own efforts to address the unique and challenging needs of their clients and their families. This has been a painful process, to say the least, for so many, and it has not been lost on myself or any of my colleagues the way that all of you have stepped forward. I also want to acknowledge Odile Brunetto and Kim Mayo from the Department of Health and Human Services and the Division for Aging and Disabilities that have done very important work as well in both their advocacy and their coordination. I also in particular want to thank Rick Callahan and Pat Ritter for their collaboration with the county and with the entire team, and certainly the Primary Care Coalition for the continued role that you all play, not just in this space, but so many others that make Montgomery County uniquely positioned to be able to address the challenges both before us and take advantage of the opportunities as we go through and go forward and really take on the lessons learned. And I also especially want to thank Dr. Travis Gales, Dr. Bridgers, and the entire public health team at the Department of Health and Human Services who have been working 7 days a week, addressing more issues than I can keep track of as we have addressed the challenges from the beginning of the pandemic and now as we work on vaccine rollout. One thing I've come to appreciate is that this is a complicated issue with policy matters that cross over between the state and our local government. And this has brought to bear many gaps in the system that, as chair of the Health and Human Services Committee and as vice president of the council, I want to tackle head on and not just wait until the end of this emergency so that we emerge hopefully stronger, united in addressing the very unique and complex needs of our IDD community. And finally, I want to thank somebody in my office, Beth Schuman, who has been my ambassador and guide and has taught me so much about these issues and who has been a liaison and continued to participate in a variety of meetings, both at the state and local level, and has been working around the clock in her own right to make sure that we stay in front of these very important issues. So I just wanted to take a couple of moments to acknowledge those and so many other remarkable people that are out there. I see my good friend Sue Hartong, who is on this panel and has been an advocate for so many years. She and I worked together on a variety of issues when I was the director of the Recreation Department. But I want to assure our community, our county is here to support you. And we are going to get through this. People say that. I mean it authentically and in a very real way. So I look forward to answering as many of your questions as we can tonight and pressing, especially to our state officials, if we can't answer questions here tonight. And I know our delegation and the county executive stand ready to support us as well. So with that, Hillary, I yield back to you, as we say on the council, and thank you for your leadership. Appreciate all of you.
Thank you so much. And now we're going to go to some remarks from Dr. Gales, and then at that point we'll pause to invite questions for you and for Dr. Gales. So very happy also to introduce someone who, again, I've had the privilege of working with for a few years now, and who has also been a tremendous leader, working tirelessly for the past many months. I'm not sure if he ever has a chance to sleep, but really delighted that he was able to join us this evening to provide some opening remarks and also to answer some pressing questions that I know many of you have. So please join me in welcoming our County Health Officer and Chief of Public Health Services, Dr. Travis Gales.
Thank you, Hillary. Pleasure working with you on a host of issues over the last 3 years and continuation with that. And I was laughing because I clicked on Stella, accepted my link, so I saw that my name is Stella Sharif. So she'll get she's my great, phenomenal EAA who makes sure I get to where I'm supposed to be. So thank you for that. And thank you, Councilmember Albornoz, for the work and partnership that you do. We were on a briefing earlier this week where I think he's become the public health whisperer, because he very clearly and eloquently laid out the issues and challenges that we faced in terms of rolling out the vaccine. Thank you to Dr. Greenberg for your partnership as well, and being a liaison with this community and making sure that the concerns of the community are put forth and heard or delivered to the county. And as Councilmember Albornoz mentioned, there are a host of other folks as well who are a vital component of advocacy. But the most important community to say thank you to is to everybody on the call in terms of being advocates for your family members, yourselves, your community, and making sure that the voices of all of those included in that group are heard and we are aware of your concerns. Now, as it relates to vaccines, there has been, I don't know if confusion or chaos is the right word. There's definitely been some misdirection in terms of information. Now, we as a county have been very clear about where we stand in terms of our prioritizations and how we move forward. Let me just first say a lot of what we're trying to do, and even what the state's trying to do, is because we have a limited number of doses and we have limited vaccines and not enough to go around for all of the people who are eligible based upon the criteria that's been put forward by the federal level, the state, and the local level. But we certainly, I'll be very candid, we were under the impression that D&D and IND group homes were to be included in the first wave, which they are in terms of long-term care facilities. And the state has begun that process. They've called it 1B, but they've begun that process in terms of rolling out vaccines to individuals who are in congregate living situations and settings as part of a federal pharmacy partnership. So all of those doses in that program is entirely coordinated by the state with conversations with the federal government. And those pharmacy partners who have been linked to each of those home sites to handle distribution and dissemination of those vaccines. Now, the other issue becomes is not everybody lives in one of those homes. And what do you do for those folks? And so we have approached the state and asked very clearly for delineation and clarification on that. And the response from the state was that anyone who carries an intellectual disability or developmental disability diagnosis would be eligible for vaccination in the 1B group. We actually had a conversation to give some backstory. Health officers meet with folks from MDH 3 times a week at a minimum. And on our most recent call on Monday, I'm sorry, we had a call yesterday, but on our call Monday, We had not Deputy Secretary, but Secretary Beatty was on the call to advocate as well and to listen to the concerns that we had in terms of increasing access to the vaccine and how to roll that out. What we also asked is how are we defining diagnosis, and to get clarification from the state on that to make sure that we have adequate and appropriate coverage for everybody coming in who needed coverage and needed the vaccine in the 1B setting. And the other thing that they did clarify was that, so the actual individual with the diagnosis was eligible for the vaccine for 1B, but any of those other folks who are providing care and services and support to that individual in the home setting would be eligible for the vaccine in the 1C category. Now, to set the larger picture, I said 1B, 1C, 1A, what does this look like in terms of vaccine rollout? So for the county apparatus right now, for the county-led vaccination sites, we are vaccinating everyone who's in 1A and individuals in the 1B category who are 75 years and older. That's what we are prioritizing through the county sites at the moment. Now, the other sites that are available throughout the county, including partnerships we have with Holy Cross, Adventist, and Johns Hopkins, which is going live this week, individuals who are in 1A, 1B, and 1C are eligible to utilize those platforms to get access to the vaccine. Now, we as a county will continue to move through. Again, we're trying to prioritize and get our seniors through first. And then the next phase would be other individuals in the 1B category, including essential employees, including our teachers and education staff, and frontline workers in a host of different industries, as well as individuals who carry this diagnosis. And so, but as it currently stands, the county site is prioritized 75 and up. But these other sites, and also including other retail pharmacies that have been brought online in the last week, are eligible for anyone in 1A, 1B, and 1C categories. So now the obvious elephant in the room is there's not an infinite supply. And so unfortunately, in many of those situations, even though folks are eligible to access them, they don't have enough slots. And so as Councilmember Albanos mentioned, we're continuing to work and advocate with the state to get an increase in doses and increase in supply so that we can begin to staff up and support these different clinics and venues to increase the number of doses available to the general population. I will stop there in terms of opening remarks, but happy to answer any questions that you all may have. I tried to summarize based upon some of the questions that we've received directly and some of the conversations that we've had with Dr. Greenberg in terms of some of the larger, broader concerns that folks have. Thank you for your time.
Thank you so much for those opening remarks. And I believe that in the course of your remarks, you did answer one of the first common questions, but because it is so common, wanted to call this out, which is, how do those with intellectual and developmental disabilities who live at home get vaccinated? You've stated that they're in priority group 1B, but if they have difficulty getting to the sites, what may the options be with regard to that?
Right now, we're not doing in-home vaccinations. However, what we do encourage folks to do, and we're continuing to tease through and develop strategies around that, because we do know that access to transportation, those issues isn't an issue just for this particular population. It's an issue for a lot of folks. So we're devising and continuing to work on some strategies to address that. But what we do ask folks is, on our pre-registration site now, you do have the ability to go in and pre-register so that we have your information. And we've included as part of the criteria links and eligibility criteria, diagnosis of intellectual developmental disability as part of that process. And so when you pre-register, you can click on that so that we have your information. And we also have questions related to that ask, is transportation an ability to get to a test site an issue for you? And that will help us try to figure out who is in that population and what particular services they may need to help facilitate and foster them getting the vaccine.
Thank you for that, and particularly for calling out that it is possible within the drop-down menu for the county pre-registration system to indicate if the patient has an intellectual or developmental disability. Do you know if that is the same for the hospital partnership systems? Is it one pre-registration system that everyone is using, or will it be a different pre-registration system depending if people are trying to go to some of those hospital partnerships that you referenced?
Well, unfortunately, Hillary, if we had one central eligibility system, that would be great, but of course, that's not the case. So the pre-registration system is actually the county system that we've set up for the county apparatus. Now, each of the hospitals and even the retail pharmacies that are doing vaccination have their own separate systems. I believe we are the only one that is utilizing a pre-registration system. The rest are you register, you get an appointment, you show up, and you get the vaccine. Now, that said, we are working with the hospitals to share our information that we get. So, for example, with the pre-registration system, we will be able to compile that information and be able to say, hey, if you're looking to include Group X in your allotment, here are some folks that have signed up and registered for the county system that could benefit from that, and sharing that information with them so that they can do some proactive outreach to folks and let them know that vaccine slots are available. And so I see a couple of questions asking about the registration links. I don't have it memorized, but if you go to the Montgomery County COVID vaccine site, it's got a whole list of frequently asked questions, as well as at the very top of the page, it has a link to the pre-registration format and survey. So it's right at the very beginning, and it also tracks and shows you where we stand. There we go, someone's put it, Deborah, thank you. It shows where we stand in terms of moving through the prioritization groups, as well as a breakdown in terms of who is included within those respective groups. It's a great resource of information. Thank you, Deborah, for putting it in the chat.
Thank you. Another common question that's coming in is related to the is clarifying who falls into the different phase categories 1A, 1B, 1C, specifically clarifying teachers for those who have intellectual and developmental disabilities, or home caregivers.
Yeah, so teachers and educators have been grouped in the 1B category. Again, I am stating the state's language that we asked. The health officers actually asked clarification on this, and the language that they provided to us was that any home care staff associated with taking care of an individual, whether it's family members or other staff, would be grouped in the 1C category. And that's how the state has differentiated within that. Now, certainly at this time, it's open to 1A, 1B, and 1C. So at this point, everyone is eligible to access the vaccine. Again, in those 9 county sites, we will eventually get there as we continue to move through, as we're prioritizing those over 75 at the moment.
Thank you. And there's one more question related to the logistics of how to navigate the process. And then I definitely want to move us into some of the panel discussion around frequently asked questions about the vaccine itself. So the last process question is, what kind of documentation do people in the 1C category need to show? For example, the parent of an adult child with an intellectual developmental disability.
Well, that's another excellent question, a very logical question. And we have put out a question to the state to ask if there is there some way to formalize a diagnosis, in terms of that. At this time, we're just asking people to pre-register. I think an acceptable letter from a healthcare provider to confirm one's diagnosis and confirm that they are the parent of it would be more than acceptable. And again, the reason why we do this, we're not out to try to make this overly complicated. We're just trying to make sure it's a fair, equitable system so that those who are eligible do get it rightfully, and we don't have any other individuals taking advantage of any lapses in the system, to try to get ahead of those who are not deserving, because everyone's deserving of the vaccine, but have met the eligibility criteria at the time.
Wonderful. Thank you so much. Thank you again to both Dr. Gales and Council Vice President Albornoz for joining us this evening. We hope you can hang out with us for a little longer, but also we'll understand if that's not possible. We certainly acknowledge and appreciate the pressures on your time. At this point, I would like to move us into introducing our first panel, which includes a clinical perspective on the vaccine. I'm going to invite our three panelists for the first panel to turn your cameras on, and any other speakers who are logged into the Zoom to turn your cameras off at this time, just so that we can see all three panelists on the screen together. Please join me in welcoming Dr. Carolyn O'Connor, who is a board member of the Montgomery County Medical Society. She's a family physician with over 30 years of practice experience, and is an active participant in the American Academy of Family Physicians and the American Medical Association and MedChi. Dr. Ali Fatemi, who is the Chief Medical Officer at the Kennedy Krieger Institute, a pediatric neurologist and the director of the Division of Neurogenetics at the Moser Center for, I'm going to struggle with pronunciation, leukodystrophies. I practiced, but may have stumbled a little bit. Dr. Fatemi is also an investigator at the Hugo W. Moser Research Institute at the Kennedy Krieger Institute, and a professor of neurology and pediatrics at Johns Hopkins University. And Katie Capano, who is a nurse midwife and family nurse practitioner, an activist and a yoga instructor who's had significant international experience and safety net experience, including having spent some time earlier in 2020 in New York City during the early stages of the pandemic. We welcome all of you and we look forward to a great discussion with you. The way this is going to work, I will provide comments. I will direct the comments or questions to you from the pre-developed questions that were shared with our panelists a couple of days ago. To our audience members, please continue to put your questions into the Q&A box within the Zoom, and the event staff will go ahead and continue consolidating key themes to send those in to be posed to our panelists. So the first question is for Dr. O'Connor, and this is related to really understanding how does the COVID-19 vaccine actually work? What is an mRNA vaccine? What does that mean? And can you sort of dispel some of the myths that may have started to circulate about what it means to have an mRNA vaccine?
Well, first of all, thank you so much for inviting me, and I'm honored to be included. I am a family physician practicing in Rockville. I wanted to say just a couple of things about vaccines in general. The immune system is part of our body that protects us from foreign invaders like bacteria and viruses. And it does this by recognizing when a protein or a cell is foreign and creating antibodies, and then other cells destroy that invader. Some vaccines work by taking the virus and reducing its strength but introducing the virus. That is not the case here. That would be a live type vaccine, live attenuated like measles. Some vaccines have the proteins of the virus and inject that in our body, and then we create antibodies to those proteins. That would be like the flu vaccine. mRNA virus vaccines, are interesting. What has been derived is the sequence of RNA that is the genetic material of the coronavirus COVID-19 spike protein. That's the little protein on the surface of those viruses that we've seen its picture so many times over the past year. The genetic information for that RNA to create that protein is what's injected in our arm. That is then taken up in our cells The part of the cell it goes into is called the cytoplasm. And I know I might be getting a little technical, but I want you to bear with me because I think it speaks to some of the myths and concerns of people. So in our cell, inside is a smaller part of the cell called the nucleus, and that is where our DNA is. The mRNA vaccine does not enter the nucleus. It stays in the cytoplasm and uses the machinery of the cell to create that protein. That spike protein is a foreign protein. Our immune system recognizes it, creates antibodies. I'm armed with my antibodies. Then if I encounter the actual coronavirus, I am ready to fight it off. But the reason that it does not affect our DNA, I know that's been a common myth, common question. The mRNA that comes in through the vaccine does not interact with our DNA. It doesn't go into the cell nucleus. It cannot affect our own genetic material. I hope that answers the question.
Thank you so much. Yes, that was very helpful. The next question is for Dr. Fatemi. Could you talk about why this vaccine is important for people with intellectual and developmental disabilities specifically, and for those who support them? What are the benefits for this subpopulation of people?
Yeah, thank you. And again, also, I appreciate the opportunity to be on here to talk about this very important topic. So there is, it's, I think, pretty obvious to the audience here that individuals with developmental disabilities and intellectual disabilities are really probably the most affected by this pandemic, and it's a multifaceted sort of way how they are affected. On one end, you are dealing with individuals who have a harder time adhering to all these new world requirements, such as masking, keeping physical distance. It's incredibly difficult for somebody who is autistic and has sensory integration issues, for instance, to wear a mask. That in itself is a challenge. And obviously, the hygiene issues have always been a challenge in this population, so now much more so than before. But importantly, there is now studies that have come out in the last few months that have looked at the mortality rate, how many people with different conditions die when they have COVID. And this was, to some degree, a surprise perhaps, but individuals with developmental disability are at highest risk of dying from COVID. In fact, the risk is 3 times as high as the average population when they get COVID. In comparison, for instance, in that same study, they looked at individuals with Alzheimer's, and the risk there was 1.5 times higher. So the risk was twice as high in individuals with developmental disabilities compared to those with Alzheimer's. And so that in itself is an important issue that we have to take into account. We are dealing here with a highly vulnerable population that is already having a big challenge with adhering to the usual guidelines that we have. And so therefore, we are really in need of getting these people protected. And in this cohort of individuals, of course, many of them are perhaps younger than the age group that is approved now for vaccines, right? The vaccine is only approved for 16 and above, and then that's only one of the two, right? And so we have many children, teenagers who fall under that category, or younger children who fall under that category. And we believe, although there isn't, the study that was published was on adults, we really think that that's applicable to pediatric population as well. That, when you're 14 years old and have IDD, you're probably at the same risk as when you're 16 years old. However, you can't get the vaccine right now because it hasn't been tested in that population. So it's not just the obligation for us to make sure that the individuals with developmental disability themselves can get the vaccine, but there are many who can't, and therefore it's also important that the care providers of those individuals get the vaccine, the parents, the caregivers, and the other direct supports of the individuals here. And so I think that is why it's necessary. What is the benefit? Well, it's to protect you from dying from COVID. That's the bottom line. I think it's pretty straightforward. We know with these large studies that have been done a lot about the side effects now, and certainly as far as we can determine, and as far as the FDA and the European regulatory agencies also have determined, it's much safer to get this vaccine than to get COVID. So that's the bottom line.
Thank you so much for that answer. And you began to sort of set up the next question by talking a little bit about some hesitancy that exists about getting the vaccine and questions about it, which you know, certainly are connected to many structural and historical things within our society. I wanted to ask Katie, you've got such diverse experience having worked with Doctors Without Borders, having worked you know, through to a New York COVID ward. Given your sense of sort of the diverse feelings that exist among different patients in different parts of the world, what kinds of messages are you sharing with your patients about the importance of this vaccine?
Thank you very much for that question, and thank you for inviting me to be here. I think the most important thing I talked about was exactly what was just mentioned, is that at this point in time, it really seems like we have two major choices, and one choice is to get the vaccine, and the other choice is to keep ourselves at risk for most likely contracting COVID. So if you look at, you know, 1 in 1,000 Americans have died from COVID, and we're getting close to 1 in 100 Americans contracting COVID. The risks of contracting COVID are significantly high at this point as Americans in this country, and it's really important to weigh the reality of that against the reality of getting the vaccine. Another thing I always like to talk about is, you know, what someone's personal history has been with medicine. I mean, as we know, there are in this country, a lot of issues with systemic racism and structural classism. And there's a lot of vaccine hesitancy in different groups based on race, based on immigration status. I mean, I work with a lot of undocumented patients right now at Johns Hopkins as a midwife, and a lot of our clients are very concerned about registering based on their immigration status to get the vaccine. So there are a lot of very different issues to be addressed within the healthcare system. It's a really good time for all of us to do some deep self-reflection about some of the atrocities that have happened within the medical system in America towards certain groups, and a really good time to be open and honest about vaccinations in general. I know prior to the COVID pandemic, I had spent time, as you mentioned, with Doctors Without Borders in Northern Nigeria, and for the first time actually witnessed what it was like to see people die from vaccine preventable illnesses. And prior to COVID, I would always counsel patients who are vaccine hesitant about, you know, living in America. We haven't really seen what it's like to live through a pandemic, but here we are, and now we don't have that privilege anymore. And I think it's really important to recognize the reality of where we are, whether or not, you know, in your day-to-day, you might not be seeing COVID every day in the hospital and people dying every day in the hospital, like most of us in healthcare still are. Maybe you don't have a family member yet, but chances are you will at this point. Chances are very high that you will.
Thank you. So if I sort of merge what our last two speakers had said, what I'm hearing is the key message is that, you know, receiving the vaccine, it helps keep you safe, and it helps keep your loved ones safe. It helps keep those individuals that you're caring for safe if they're in an age group that is not yet eligible to receive the vaccine. But Dr. Fatemi, are there any people who shouldn't take the vaccine? You mentioned those who are under age 16 for whom the trials have not been conducted, but are there any other reasons that people, particularly people within the IDD community, should not take the vaccine related to their medical conditions?
So at this point, you know, to point out that the use of the vaccine is under emergency authorization, which means that the trials are still ongoing, and we're still learning a lot about the long-term effects of this vaccine. So what we can conclude now is based on the short-term effects. And based on the short-term effect, these were huge studies. In one of them, there were 44,000 people by Pfizer. I think Moderna had about 30,000 people in it. And so they included lots of people with different kinds of baseline conditions. And so the conclusions that we can make right now is basically based on those. And what the FDA has decided to say, which I totally agree with, is that really the only clear contraindication is for somebody who had gotten the vaccine, the COVID vaccine, and had an allergic reaction. So meaning basically you got your first shot, you had a severe allergic reaction, you're not going to be able to get the second shot in that situation. But for all other circumstances, essentially, there isn't a 100% no. There are some circumstances that have to be strongly considered. There is, for instance, a question about what about people who are immunocompromised? Those individuals are actually at the highest risk again, because they are immunocompromised, highest risk from COVID, not the vaccine. Because, if you don't have any immune system at all, then you're going to be affected by this virus much more, obviously. And so the studies included some limited information about those individuals. They had individuals in there who, for instance, had stable HIV. And although the data is limited, there wasn't any side effect or any contraindication noted. And from a mechanistic perspective, like Dr. O'Connor just explained, there isn't any rationale to think that people who are immunocompromised should not get this vaccine, because this is not a live virus that people are getting. This is just a little tiny sort of lipid particle that has this RNA piece inside it. It's nothing alive that people are getting injected with. So for that population, we recommend that they discuss it, of course, with their doctors, but there isn't any contraindication. And then, there's been also a lot of talking about pregnancy and lactating mothers. So the studies were designed in a way that if you were pregnant, you could not enroll in the study. And as a consequence, again, the data is limited there. However, because the studies were so large, there were at least 23 women in one of the two trials that were done that became pregnant throughout the course of the trial. And as far as we know, there hasn't been any problem as a consequence. In addition, there were animal studies that were done in rats for the Moderna trial before they went into human, where they tested the effect of the Moderna vaccine on pregnant rats and on the offspring of the rats, and there was no known side effects. So while we recommend that each person should discuss that with their individual physician or provider, there isn't any real contraindication for that cohort neither. And essentially, like I said, the only clear contraindication is if you have had an actual full-blown allergic reaction. Now, if you're known to have allergic reactions against vaccines in general, that might be another special consideration that you should discuss with your physician, but it's not necessarily a no-no. It may still be that you can get it, but there may be some additional precautions that should be taken.
Thank you. And I see that the program team has started sending me many questions that are in the chat. So I will try to consolidate those into some of my questions as well. The next question is really about the logistics of a 2-dose vaccine. There are important questions like how long might someone have to wait after testing positive for COVID before starting the process? What happens if there's too much time between the first dose and the second dose? And could someone get the Pfizer vaccine for the first dose and the Moderna vaccine for the second dose? Katie Capano, would you chime in on that one?
Sure, thank you. So in general, we do not mix doses. We don't recommend mixing doses. So if you get the first vaccine as a Pfizer, the second should be Pfizer, same with Moderna. There have been some concerns about vaccination supply, as we all know. And I know that both of the vaccine companies had said that, if you have to spread out the 2-dose series from, I think it's 3 weeks with Pfizer and 4 weeks with Moderna, if you had to spread it out a little bit more, I think the study said up to 42 days, you still get quite good efficacy with that. And I mean, the other answer is we're still learning. And I think there is an ethical question of what is best. Is it best to have a smaller amount of people get 2 doses, or a larger amount of people to get 1 dose and still get, at least 50 or 60% protection? I think one of the things that I also remember is that when this all started and we were talking about vaccines, we were all really excited about the idea of 60% efficacy. And here we are with these vaccines of 95% efficacy. So even if you just got the 1 dose, that would still give you an efficacy. By efficacy, I mean how well it works, how effective it is. So I think even if you got the 1 dose, obviously the goal is to get 2, but even if you just got 1, that would still give you significant amount of protection. And so my recommendation always is that when you can get the vaccine, to get the vaccine.
Thank you so much. Dr. O'Connor.
I was going to just address the other question was about if you've had COVID, when can you get the vaccine? I believe that initially they had said to delay, but I think the CDC is now saying that once you've served your quarantine or your period of time in isolation, you can then go ahead. The one rule is some of our older folks and people with certain underlying health conditions who are test positive for COVID may get a treatment called monoclonal antibodies, which is an outpatient treatment. And some patients who are hospitalized can get another treatment called convalescent serum, which is also antibodies being instilled into the vein IV into the body. If someone has been treated with either of those, they should wait 90 days for the vaccine. And the idea would be that the antibodies they were given could block the vaccine taking effect. So that's why there's a delay. But for people who actually had COVID, they can start once they finish isolating. I'm sorry, and I interrupted you, Hillary. You were about to ask me another question.
No, that's fine. You actually preempted one of the other questions in the list. So thank you for that. But would you also talk a little bit about the ingredients of the vaccine and, if there are things that could trigger significant allergic reactions, preservatives that people might need to be aware of or anything like that?
As far as I understand, and remember, I'm a family physician. I am not a vaccine expert. I wasn't on the team that created or manufactures or regulates these vaccines, but there's no, there are, as far as I understand, it's what Dr. Fatimi said. There's the lipid, there's a fatty little outer shell, and then the mRNA inside. And there is no preservative, there's no mercury, there is this does not carry adulterants. And it's really quite marvelous how far we've come. And I really think that we need not worry about that. This is a very straightforward kind of injection.
Thank you. And then the next question can actually go to anyone on the panel who would like to respond to this. Are there side effects for the second dose of the vaccine more pronounced than for the first?
Evidently, that's true. As Dr. Fatimi said, the studies were huge, 30 and 40,000 people. And now we have millions who've subsequently received have now in general use received it. My understanding is that 14% get fever after the second dose of Pfizer. And I think that that's just one particular factoid that I know, but that it seems like the second dose is worse. And for those of us over 50 who've had Shingrix, which is a shingles vaccine, nothing related whatsoever, but the side effects are more than they are with, say, a flu shot. So be aware, know that could happen. Take some Tylenol, take it easy. You'll be better off with this having been vaccinated than running the risk, as Katie said. The only way through this is through immunity. You either get it through vaccination or through natural infection, and that is not a gamble I'm willing to take.
Would you mind if I added something to that?
Please,
sorry,
go ahead. Please
Dr. Eddy.
No, you go ahead, please. Go ahead.
Okay. I was just going to mention that I also contracted COVID, a pretty moderate to severe case back in June. And for those of us who've had COVID, the first dose is a little bit more intense than the second dose, is what I've just been noting anecdotally. I don't know, because a lot of my colleagues also have had COVID and went through the series. I haven't seen research on that yet, but as someone who has both had COVID and then now had 2-dose series, COVID was so much worse. So just that's some food for thought. The other thing I also would just like to touch upon is I saw some questions coming through for pregnancy and fertility, if it's safer to get the vaccine. So whenever I have these questions, I think about what do the experts say? And so there's a couple different experts in this country. There's the American College of Obstetrics and Gynecology, who are the doctors. There are the Society for Maternal Fetal Medicine, who are the high-risk pregnancy doctors. So if you have a high-risk pregnancy, that's your specialist. And then there's the American College of Nurse Midwives like me, who specialize in lower-risk pregnant people. And then there's the Society for Fertility Medicine. And so it's really hard to get all of the experts to agree on something, to be completely honest. And the one thing that we fully all agree on is that we do recommend the COVID vaccine for pregnant people and for people undergoing fertility treatments. Again, if you think about if you get COVID, if you're pregnant, you have a higher risk for having ending up on ventilated in the ICU. Now we're seeing increased risk for preterm birth. I mean, there are a lot of significant sequelae from actually getting COVID while pregnant. And as Dr. Ali was mentioning before, we don't have any major concerns about COVID reaction, COVID side effects for pregnancy, just based on the mRNA vaccination and the way that technology works. So just some food for thought that we all are recommending COVID vaccination in pregnancy and fertility.
Thank you. And Dr. Fatemi, did you want to jump in there?
I was just going to say, I got my second shot of Moderna yesterday. Woke up today with some headache. The side was hurting. Took a dose of Advil, and I feel fine now. So I think that certainly the second dose is higher. But yeah, I'm still alive. So whatever that counts for.
Well, thank you very much. And I think the last question to wrap up this panel, which I think I'll also ask you to field, Dr. Fatemi, and then others can jump in. Are there any studied side effects specific for the IDD population?
Basically, the short answer is that we don't know. It hasn't been reported. Of course, the trials did not, when they were conducted, they did not get into the detail whether the individuals had any form of IDD. What they did say is that people had to consent to the study. So I assume that it included only individuals who were able to themselves consent, which may exclude some percentage of people. But again, from a mechanism perspective, there is no reason to think that they should be at higher risk for the vaccine to have side effects, but they certainly, as we discussed earlier, are at much higher risk of from COVID infection. And so, no, there isn't really anything more to say to that, other than that the study did include individuals with other pre-existing health conditions that are common in the IDD population, like obesity, diabetes, and so on. And again, those are individuals that are high risk for COVID infection. So they should be all getting the vaccine.
Okay, thank you. Thank you all so much for sharing your expertise and your perspectives with us this evening. This has been a great discussion. There have been so many questions popping up in the chat, and I definitely want to give a call out to the program team here who are working behind the scenes with me to sort of consolidate all of the questions and try and pull out those common themes. A virtual round of applause to all of our panelists for the first segment of the program today. I'll invite our first panelist to turn off your cameras and welcome our second panel, which includes Earl Hargrove, who is a direct support professional at the ARC, Janet Edwards, who is customized employment consultant at SEEK, and Sue Hartong, who is a teacher and mother of 2 children with autism and genetic disabilities. As we go into the second panel, this is going to be a different tone of conversation, but I hope that as we sort of wrap it all together, the program, you'll find that the remarks from the first panel and second panel really are complementary to one another. So for our first panelists, I'm going to start by inviting you to just go one by one and briefly share why you felt it was important to be on this panel. You know, introduce yourself, give us a little bit of your background, and share why you felt it was important to join this panel. Earl Hargrove, would you like to go first?
Sure. I work with the Montgomery County. The reason I took the vaccine, I wanted to protect my family, myself, and the individual that I support. And also, when I'm out in the community, I also like to protect others too, because if I had the virus, I could pass it to one person or two individuals or three consumers, and that person can pass it on to the next person. And so therefore, how a pandemic will continue, the numbers will continue to go up. So I took my first shot on the 11th of January. I didn't have no side effects. And I took it like 9 o'clock in the morning, and I had to be on shift at 3 o'clock that evening. When I took it that morning at the community center, I went home. I took 2 Tylenols and went to sleep because I was still sleeping from the morning. So I took 2 Tylenols and I was okay. But I didn't have no side effects, and I'm glad I took the vaccine because I rather have some side effects from the vaccine than catching COVID and have long-term side effects, or I might die, you know, if I catch COVID. So the benefits, when the link was in my email, I jump on the opportunity very quickly. So I wanted to take it at first before the vaccine was out. I kind of hesitate. I was saying to myself, well, I'm going to wait to see how everybody else is going to do. So then I started seeing the numbers going up, and other people started taking it in the media, like the vice president, the president, Dr. Fauci. And I said, well, I'm going to take it too. So I jumped on the opportunity and I took it. And I'm glad I took the opportunity. And I will be taking my second shot on the 8th of February at Kaiser. So I encourage my coworkers that I work with to get the vaccine. And I had a few coworkers, I have them sign up to get the vaccine. So I encourage everyone to get the vaccine because the COVID is real. So you don't want to catch that. So I encourage everyone to get the vaccine. Thank you.
Thank you. Janet Edwards, would you like to introduce yourself and share why you felt it was important to join this panel?
Yes, thank you so much for inviting me to this webinar. I am Janet Edwards, and I am employment consultant at SEEK. I help match people to jobs, paid employment, based on their skills and what they enjoy doing most. It is very important. It was very important for me to take this vaccine because I want to be an example, a good example to people that are scared of the vaccine. Some people are saying, if you take the vaccine, you'll go out of your mind. Some people are saying, if you take the vaccine, you'll turn into a monkey or an ape. And people are spreading so many rumors. I took it and I posted it on some social media to see while I was taking the vaccine, so that people will know that I've taken it and I've not changed into a monkey. I've not lost my mind. I am still Janet Edwards. And so many people are dying of it. If there is something to keep me alive, why don't I go for it? So that is the reason why I went for it, so that I'll be an example to people, to tell people not to listen to what people are saying. There are so many unqualified people that are posing as doctors, medical doctors, and they are not. People, please listen to science. Listen to science. Look at what science is doing. Look, let some of us that have taken it be examples to you people. We have not died. We have not lost our minds. We are not monkeys. We have not turned into anything. We are still the same people. So I beg you all, go and take the vaccine. It is available to you. Go get it.
Thank you so much, Janet. And I'm actually going to ask you to talk a little bit more, because you referenced that you felt like it was important to look at the science, and there's so much information out there. Some of it's good information, accurate information, and some of it is misleading. Would you talk a little bit about how you did your research? How did you go about thinking about the information that was coming to you to decide, okay, I'm comfortable with this, I'm going to go get that vaccine?
I don't think she heard you, Hillary.
Janet, I think you're on mute.
Yes.
So would you talk a little bit about how you did your research to decide that you were comfortable to get the vaccine?
Okay. I'm always listening to the news, especially CNN and MSNBC. And I was always getting news on the vaccine. And what motivated me the most to go get it, I saw like doctors, medical people, they took the vaccine on national television and nothing happened to them. And what convinced me the most, the director for the agency that I worked with, Karen Lee, she took the vaccine and she was on the a conference call. Nothing happened to her. I saw her on the call, I listened to her on the call, and several people took it from that I work with, and nothing happened to them. So I said to myself, I am going for it. I went for it. It was just a small prick, and that was it. And it is just like normal vaccine. When some people take vaccine, they will get a little bit of soreness. That was all I felt on the day. And the next day, I couldn't tell which arm I took it on. And people were telling me I'm an African chicken, I don't feel anything. I said, yes, I'm an African chicken, but I'm not going to stay until I die. If there is something available for me to prevent me from getting the virus, I am going for it. So people taking it on national television, my director taking it, and she was alive. That was what motivated me the most to go for the vaccine.
Thank you for adding that, and I think that's part of why for Earl and Janet, it's so important for you to be speaking tonight, so that you can tell all of your colleagues within the community what your experience has been too. Sue Hartung, can I invite you to provide your introduction and share why you felt it was very important to be on this panel?
Thank you, Hillary. Yes, my name is Sue Hartung. I have 4 children. My daughter, Emily, is 31 and has autism. My son, Warren, is 35, and he has a rare genetic disorder that is in the spectrum of autism also. I wanted to be on this panel because I think, like many people in the audience tonight, I know the pain and frustration you have been feeling for almost a year now. If your child with a disability is at home with you, you're struggling to explain to them why their life has changed the way it has, why they can't do what they did a year ago. And if your children, like my children who are in a group home, you have not been able to interact and be with them like you were formerly. It is just heartbreaking. I will tell you that many people who've been on this panel or were on earlier, I have been writing and advocating to for almost a year. And really for the better part of 30 years, I have been advocating for my children because, while I think they have a very good understanding of the world and what's going on around them, they are limited in their ability to communicate what they want for themselves, and fought for years to get them out in the community. And now we've had to totally reverse that and tell them, no, you can't go out in the community. You have to stay home. It's safer to stay home. My son my daughter's extremely healthy and my son is not. He's been hospitalized multiple times. He's had pneumonia several times. I have sat there with him in an ER and just held the oxygen mask kind of like near his nose in an attempt to get his O2 levels up to where they should be. If your child won't wear a mask, they are not going to wear an oxygen mask. If they should contract COVID, and I'm curious when these studies are all done, if one of the reasons they're at more risk is their inability to cooperate with the kind of treatment they would need in a more restrictive setting. I just know it'd be very difficult for myself and my husband and my son. So I don't think, I have a feeling everybody in the audience who has a child with a disability, I'm guessing that 90% of the ones that are here want their child to have the vaccine. They just want to know how to get the vaccine. And I think it's beginning to roll out. I think we have to be patient, but we have to be strong advocates. And thank all those direct service professionals who have been so wonderful about reducing their hours, changing their hours, all the providers who are working with their kids to make sure that they have stayed healthy. My children have been exposed three times through no fault of their own. But it takes 3 people to get my son to get the COVID test done. It's not an easy thing to do. But I so appreciate how much you and all the people that you represent have done to keep my children healthy and alive. And I have to tell you, they're doing really well coping with this new society that we live in, probably better than I do at times. My kids have not gotten the vaccine yet. I see a question about that. I am hearing that they should be soon, but they haven't. So just keep asking, be polite, but firm. That's what I always try to tell people.
So Sue, we know you're an advocate for the vaccine, as you're on the panel, as you described. Do you have any concerns about how your children might react to the vaccine?
They're going to in terms of just getting the shot, no, I think, here's a very short story. Years and years ago, I took my daughter to LabCorp to get some blood tests before she was in a residential placement. She was probably 8 or 9. We walked in and there was another client from her agency, spread eagle on the floor of LabCorp. And she would not get up for anybody. And the older people were walking around and yelling at her. And I said, Emily, go see if you can get Jessica, I don't know her name was, see if you can get her to sit in the chair. And Emily walked over and said, Jessica, sit in the chair. Jessica got up, sat in the chair. Then it was time to go get her blood taken. And we're all like looking at each other. I said, Emily, why don't you get your blood taken first? And maybe Jessica can go with you, and she will. And she went right after her. And one thing that I realized then is Jessica trusted Emily completely in a way that she could not trust caregivers, parents, or anybody else. And I think as we have to accept that our children know a lot more than we give them credit for and understand a lot more, and to maybe share that experience as much as possible. I think letting parents getting their shot when their children get their shot is really important. You know, it's modeling, which we all know how to do. In terms of the side effects, long-term effects, I think that's been demonstrated. You know, those are minor compared to actually contracting COVID. So no, for me, it's not a concern at all.
Thank you. Thank you for sharing that. Turning back over to Earl, you touched on this a little bit in your introductory comment, but could you talk a little bit more about if you had any concerns about side effects before going to get the vaccine? What did you know about possible side effects? What concerns might you have had, and why did you eventually decide to go ahead and get vaccinated?
Like I said, you know, the side effects, I heard about the side effects, but I wasn't going to let it stop me because I wanted the vaccine because I didn't know when I was going to get it. Since the ARC gave me a link that Saturday, like I haven't jumped on it. So, and I couldn't wait to get the vaccine. On my way to the site, I wanted to get there on time and stand in line. And I wasn't worried about the negative side effect, what was going to happen after I get the vaccine. So I just got there and took the vaccine, and I was proud to get the vaccine. And like I said, I only had a little small sore in the spot where I got stuck. Wasn't, like I said, no negative side effects, you know. So and I was like, I'm happy that I did get the vaccine. I wasn't worried about the side effect. but I didn't want to, like I said earlier, I don't want to catch COVID. You know, and I don't know how I was going to react to COVID. You know, at my age, I'm 61. I don't know how I was going to relate to the COVID. So I have friends that have passed away, and I don't want to I didn't want to take that chance. And I work with the individual. I work with some individual in a group home, and I don't want to catch anything, give it to them. And so I just proud that I did take the vaccine, and I you know and I can't wait to get the next shot.
Thank you. My next question, I think I'll pose this to Janet, and then Earl, I'll invite you to answer as well, because you may have had slightly different experiences. But Janet, for you, what was the process like from beginning to end? Can you help those in the audience know what to expect in terms of what forms you'll have to fill out? What was your interaction with the healthcare provider that gave you the shot like? What was the experience like for you of getting registered, getting set up, and going through the whole process?
The first step was I received an email from SEEK about getting the vaccine at a location, at a time, and then you have to register for the vaccine. And immediately I saw the email, I went and did my registration. And the next day I went there at 10 o'clock because that was the time I had the appointment. I went there, I joined the line was moving fast, and SEEK gave me a letter of authorization to show that I worked there. So I took that letter with me. And when I went there, I had my SEEK shirt on, I had my SEEK mask on, I have everything SEEK on me. So as soon as they saw me and I gave them the letter, and they said, "Oh, we know you're working for SEEK." And excuse me, they did my registration, which took like 2-3 minutes. And I went in for the vaccine. The nurse who gave me the vaccine was so nice because I am so scared of needles. So I sat there and she said, "It's just going to be like any other vaccine that you've taken." I said, "Okay, I'm ready." And before I could think about it, she was done. And then I turned to her, I said, "Are you done?" He said, "Yes, I am done." I said, "Thank you." And then went to the waiting area to wait for about 15-20 minutes for observation. And that was it. It took like from going there, sitting down in the observation area, it was like 30 minutes and I was out of there.
Thank you. And Earl, would you like to speak about what the experience was like for you in terms of the logistics, the registration, day of the vaccine? How did it go for you?
Yeah, I first received an email that Saturday, and my appointment was like 9:45 that Monday, and I met my CEO there. She was my support. I wasn't worried about anything. She was there with me, and I had a letter from my CEO. I had my badge, and it didn't take we didn't stand in line no more than 20 minutes. I say about 15, 20 minutes. And then we waited another like 15 minutes and we was out. It was very quick. And like
Wonderful.
I said, yes, like I say, my CEO was there, and like she was my support, and it was just like I wasn't there by myself, and like I said, I wasn't afraid, but I still had support that was there with me.
And one thing that I just want to clarify from the comments that we've just heard, you both referenced you received a link and it was connected to your employer. So this goes back to some of what Dr. Gales was explaining at the beginning of the evening. There are different ways in which vaccine is available. So for those who are direct support providers, or working with agencies that support individuals with intellectual and developmental disabilities, there is a partnership between the state and certain pharmacies to set up vaccination clinics for those employees through the workplace. That is a different mechanism to the sort of more general public registration site. And that is to make sure that we're getting streamlined support for those individuals who are going into a workplace setting and maybe interacting with residents within group homes and in different places. So there are two different mechanisms, and I just wanted to clarify that in case there were any questions within the audience about that. Sue, I think I saw you raise your hand a moment ago.
That was a mistake, sorry.
No worries. No worries. So at this point, I'd like to ask this group of panelists to stay online, but also to invite other panelists to join in and to invite our the medical director for this initiative, Dr. Mike Greenberg, to unmute himself as well as we go through some additional questions that the team has been putting together. Before I go to those, though, I want to give a shout out and a thanks to Odile Brunetto, who has shared a really important link in the chat, which is, and I'll read it out twice so that people have a chance to write it down: coronavirus.maryland.gov/pages/vaccines. coronavirus.maryland.gov/pages/vaccines. That's where you can go to find up-to-date information about what the state rollout is looking like. We have people from many different counties within Maryland on the call, and different jurisdictions are handling things a little bit differently. So I definitely want to call out that state level resource. And within Montgomery County, people who would like to pre-register, this is the pre-registration process. If you are in one of the eligible groups, 1A, 1B, or 1C to pre-register, that phone number is 240-777-2982. Again, at 240-777-2982. I will mention, if you are pre-registering either by phone or by email, if you receive an email inviting you to go in and get your vaccine, that is individual to you only. Please do not share that. There has been some confusion with forwarding of those pre-registration emails that led to some people showing up at vaccine sites who were in fact not eligible and had not reached their point in the queue. So if you pre-register, if you receive an email with instructions to go and get your vaccine, that is for you specifically. Please do not forward, share, don't put it on your neighborhood listserv. It's only yours. Going into some of the questions that had come in from the panel, and I'll read the question and then we'll direct it. So, can someone who gets the vaccine still transmit or pass the virus on to others? Dr. Greenberg, I'll ask you to begin addressing that question.
Sure. So the work on that is still in process, but as of now, it's important for everybody to understand that the vaccine protects only the person that gets the vaccine. So if you receive the vaccine, then you are protected from getting COVID, which is the illness. It does not necessarily prevent you from being able to spread the virus to someone else. It's a little hard to understand at first, but if people think about two separate things, one is being sick with the virus and the other is having the virus in you or on you. The vaccine prevents you from getting sick with the virus. As of right now, we don't know, but it's possible that the virus can still be, for example, in your nasal cavity. So you could still pass it on to somebody. And that is why even when you get the vaccine, for now, the same recommendations about wearing your mask, washing your hands, social distancing, those all still need to be observed. So the best way to think about it is that the vaccine protects you. It doesn't necessarily protect others.
Okay, thank you. And another logistics question. Can you get the second shot in a different arm?
So yes, generally speaking, there's no particular difference what arm you get the vaccination in, right arm, left arm. Sometimes there's some logistical things depending on the way the table's positioned, but you can get either vaccine in either arm. It doesn't make a difference.
Okay, thank you. And this is a question that now I'm going to give my own disclaimer. I am involved in communications and organizational strategy. I am not a physician by any means, but we have many on the panel. So I say that disclaimer because I do not in fact understand the question, but I'm going to ask it, and then those who may can chime in. And it says, what are the considerations for patients' methylation status before administering the vaccines? Are there any things to be thinking about in terms of individuals who have developmental disabilities also being under methylators?
Happy to address that, Ivan.
Thank you. Please go ahead.
Yeah, mechanism of action of the two current vaccines does not involve the liver. When we talk about, under methylators and so on, this is about individual who basically process drugs in their body, and that's usually happening in the liver. So it is irrelevant and shouldn't happen.
Wonderful. Thank you for addressing that question, and thank you also for teaching me a new term, because that one was new to me. I was not familiar with that term before. What about, and Dr. Fatmi, this might be another one for you. What about those for those with comorbidities like COPD, CHF, seizure disorder? Can they also similarly take the vaccine related to what you had described earlier in terms of the mechanical process, not necessarily excluding based on those health conditions?
So basically, the studies included those individuals. The trials included those individuals, and they also looked whether things like heart attacks and strokes are happening more frequently in those who got the vaccine. And the bottom line answer was that there wasn't any difference. So people who got the vaccine, they benefited from having the vaccine if they had these underlying conditions, and B, getting this vaccine did not increase their risk of having a heart attack or strokes compared to the general population. So it's essentially not affecting it. Does that address the question?
I believe so. That comes to the question that was in the chat. Thank you so much. And I'll remind our audience members that you can continue to put those questions into the Q&A box. The staff are compiling those, looking for common themes, and sending those in to me to pose to the panelists. One question that came in just a few moments ago is, what about the timing of this vaccine, the COVID-19 vaccine, as it relates to other vaccines? So for example, do you have to wait if you've had something like a meningitis vaccine recently?
I can tackle that. My understanding is that we should space, COVID vaccine should be given alone with no other vaccines on the same day, and that we should try to put a 2-week window between that and other vaccines. So if I got another vaccine, I should wait 2 weeks. If I get COVID, I should wait 2 weeks before I get another vaccine.
Thank you. And Dr. O'Connor, you might be able to chime in on this one as well, which is about sort of self-care after taking the vaccine. Does it make a difference what people might use in terms of painkillers after taking the vaccine, Tylenol versus Motrin versus something else?
No, I don't. It does not matter. I think it's personal preference, allergies. If someone's pregnant and they do choose to take the vaccine, I think they would be better to take Tylenol. I'm sure Katie could comment on that, but there's no difference.
Agree with Tylenol.
Great, thank you. And I'm currently seeing no unaddressed questions on a theme level in the chat. I do briefly want to just reiterate that because there are people from many different jurisdictions on the call and counties are handling their registration processes differently, we won't be able to give specific instructions about which sites are doing what from a logistics perspective. The best place to find that information, your best starting point, is again to go to coronavirus.maryland.gov/pages/vaccine. That can be your starting point, and that will be a way that you can link into what's happening in counties all across the state. A couple of new questions coming in from the chat. Which COVID vaccines would you recommend? The one requiring 2 shots or the new vaccine that is soon to be approved by the FDA?
So I can try to answer that. In very simple terms, I would recommend whatever vaccine you can get as soon as you can get it. You know, the studies are still ongoing. All the vaccines that undergo emergency use authorization are going to be effective. I don't think at this point trying to fine tune or choose one vaccine over the other has any real benefit, nor is it possible. You don't really have a choice. So the key is to get the vaccine. We do know that the 2 currently used vaccines, the Pfizer and the Moderna, both have a 95% and a 94.1% effectiveness, and it's very hard to do better than that. So I think I would say get whatever vaccine you can get as soon as you can get it, whenever and wherever you can. That would be my advice.
Thank you.
Hillary,
yes,
Hillary,
go ahead.
I wouldn't be a parent if I didn't take a moment to advocate a little bit. I know there are a lot of parents out there who are wondering how they're going to get their child vaccinated because they won't wear a mask or they have difficulty in public. And I would just encourage the county to come up with some kind of accommodation for those. We've recognized the importance of vaccinating them. I don't know if it's possible to have a separate site where people could come and get it in their car or at certain times, but I know that's a real concern among some families who just won't be able to comply with the typical protocol.
Thank you, Sue, for that advocacy, and I think it's very important for us to take note of that. So appreciate you raising that. Another question that has come in within the chat is about the new strains of vaccine that are beginning to emerge in the UK and South Africa. What do we know about the effectiveness of the vaccine against these new strains of COVID-19?
I can tackle that briefly. It's what we so far know is that Moderna's vaccine shows neutralizing antibodies to the 2 strains from UK and South Africa. I think there's also a strain from Brazil that was found in Japan. And that one, I don't believe we know much of anything. You know, this is why it's so critical for vaccine rollout to happen as quickly as possible, because if the population is all vaccinated, new mutant strains won't have an opportunity to find a lot of individuals who are still vulnerable. And this may mean that later on we will need other vaccines. They may craft new mRNA vaccines, and that's one of the beauties of this technology, is that it's flexible. The thing is that we know that, you know, coronavirus, COVID-19 is so familiar to us, but coronaviruses cause 15 to 30% of colds. We've had coronaviruses forever, and they do mutate. That's part of why I can't stay immune to colds forever, because I get exposed to new strains and my immunity may not last forever. So we're going to be confronting this problem. for a while. And I think that a lot of these questions are open. Remember, the whole thing is only 1 year old. We don't know. There's so much we don't know.
Thank you. And Dr. O'Connor, maybe you could continue on that theme in terms of, the things that we're continuing to learn in terms of how long the vaccine is expected to last and whether it will be a repeat vaccine.
Well, that remains to be seen. As I just said, if I catch a cold, my immunity will last for a while. It's unlikely I'll get that same cold virus within the same season. I think we just don't know. And I think that we have to just go one day at a time, because we're one step at a time anyway. We need to get everyone immunized. We need to stop this pandemic in its tracks. I think we will see how things go as time goes by. We won't know if there'll be another wave, if people's immunity wears off, but if everyone is simultaneously immune, we can stop it. And I know that the rollout of the vaccine, you guys are all craving it, wanting it, registering on every website. I'm so sorry that this hasn't gone better, but I think that the powers that be know that the public is frustrated, and I hope that those manufacturers and all of the people involved in logistics are going to get us where we need to go.
Thank you for that. Katie Capano, maybe I can ask you to address this next question, which is about, what do we know in terms of data on how COVID-19 survivors are responding to the vaccines? And so maybe you could pair what you're seeing in the data, in the research, and also share a little bit more about your own experience.
So again, I think a lot of this we're still learning. To be completely transparent, I haven't seen a lot in the data yet about how COVID survivors are responding as far as antibodies to the vaccine, because we don't really know very well how to measure the antibodies when someone gets an antibody test. We're still learning that too. But what I do know is that I really trust science and I trust scientists, which is why I chose to get the COVID vaccine, because it was still being recommended for people who did survive COVID. So I actually also have post-COVID syndrome, which means that I still get a lot of the neurological symptoms on a daily basis, which is again why I would always recommend getting the vaccine, because COVID itself isn't the only hurdle. It's also, many of us end up with post-COVID symptoms, which we don't know what the long-term effects are going to be yet. Again, what I can say is so I got my first COVID dose on December 17th. I was one of the first people to get it at my hospital system, and then got the second dose on January 5th. So it's been a couple weeks. And like I mentioned prior, I had gotten, I would say the day after my first dose, I didn't feel great, but I didn't feel terrible. I was still able to go to work. And after my second dose, I really felt fine. It was a completely different experience. So I haven't gotten any increased symptomology from my post-COVID syndrome, And I certainly haven't gotten COVID again, right? Because that's not really possible with an mRNA vaccine. And so, yeah, I know it's frustrating, but a lot of the answers to these questions are that we're still learning, we're still researching, and we're still learning. But at the end of the day, I really trust scientists.
Thank you so much for that. And we are just about out of time. I want to acknowledge and appreciate the contributions of all of the panelists. And I'd like to turn it over to Dr. Greenberg, who's the medical director for this initiative, to provide any closing remarks.
Just like to thank everybody for joining and for the excellent commentary by all the panelists. And most importantly, what rings out the most to me are some of the words of Janet and Earl. Making the vaccine was, in a way, the easy part. Getting people to use the vaccine is the hard part. Up to 30–40% of some populations and groups of people are very resistant, and the vaccine will only work in a real way for our society if we can get people comfortable to take it. So I strongly encourage everybody who has concerns, in the special needs community. If you're a direct support professional, speak to another direct support professional who's gotten the vaccine and let them tell you what it was like. And if you're a direct support professional who's gotten it, share that experience like Janet and Earl have, because we have to get everybody vaccinated. And that's pretty much it. It's an incredibly safe vaccine. Everything has side effects, but there have been millions, tens of millions of doses used. So get the vaccine and encourage others to. Thank you.
Thank you, Dr. Greenberg. Thank you to all of our panelists. Thank you to our audience for joining this evening, to everyone for the work that you've been doing throughout this time, for your advocacy, for your support of the community of individuals with intellectual and developmental disabilities, for your work providing healthcare across the board. It's such an honor to have had the chance to spend this evening with you. And with that, we can conclude the formal program for this evening. Thank you all.
Thank you so much.
Thank you.
Thank you. Bye-bye.
Bye. Thank you. Thank you, Janet and Earl. Keep up
Thank
good
you,
work.
welcome.
Say hi to
Thank
Miss
you.
Lee for me.
Thank you.
Okay.
Thank you.